The lower back pain rehab programs, we have seen hundreds and thousands of patients over the decade, and a lot of them have sore lower backs. Now, often people have sore lower backs because their back is doing most of the work. So our program is designed to help you actually learn how to use your glutes and hinge at the hips rather than just lifting from your back. And we include core work as well. So these are the movement patterns that are often neglected in the workplace, in the gym, in daily life. We're bringing it all back. We're enhancing your posture. We're bringing back your stability in the hip and spine. And then, how do they finish off?
On the barbell, so getting people deadlifting correctly. When we've had people present with pain previously, when we've assessed their deadlift, it's basically just pulling that weight off the ground with their back. So as Danny said, the most important part of this program is learning the hip hinge, learning how to unload the lumbar spine, put that weight back into the hips, and allow the back to do just what it needs to do rather than the whole lift. So perfecting those foundations, understanding the muscles we need to be targeting with our deadlifting and our hinging movements, but then also being smart around our loading and making sure that we're not overloading all the time. A lot of these injuries have presented with years and years and years of poor mechanics with excessive weight, whereas now we're going to strip it all back, learn the foundations, apply it to the barbell, and then be quite smart with our loading.
So there's no stretching involved, only strength in our rehab programs.
The only way to do it.